I'm Van Leavitt. I'm a general and bariatric surgeon. I'm fellowship trained in bariatric surgery, and I meet patients and discuss with them whether or not bariatric surgery is a good fit for them and their lifestyle. When the patients will come in, I do a consultation with them and we talk about any diets that they've tried in the past. And then we talk about things that have been successful for them and things that are not successful. Once we go through that, then I enroll them in our weight loss program, and then they're exposed to a whole group of providers that help with the medically supervised weight loss. Bariatric surgery is another way of providing a tool for people to change their life and increase their self-esteem and their physical activity. That is a lesser known area of medicine. And then I just fell in love with it, and I've been doing it ever since. I worked in the community as a private practice surgeon for 7 years. As soon as I finished my fellowship training, I opened a practice and started working. And through that process, I ended up meeting up with Dignity Health, who at the time didn't have any type of weight loss program. And so me and my partners, we started working with Dignity Weight Loss in order to build a weight loss program and center through one of their hospitals. And then as we built that program up, eventually it became big enough and strong enough that they started looking for providers to join, be more integrated into the program. And that opportunity arose for me, and I took it, and I've been very happy with it. We sit down and we have a very in-depth conversation about what are their goals, what are their lifestyle goals, what are their dietary goals. We talk extensively about anything that they've tried in the past, as far as diets and medications and what success they've had through that process. And then in a very informal and friendly, welcoming way, we try to present all of the different surgical options. There is not one weight loss surgery that fits all people. There's multiple different types of people. There's multiple different types of surgeries. And so we spend a lot of time going through each of the different surgeries. We talk about the pros and cons of each of them, how each one would either affect and benefit them or maybe not be as necessary for their particular scenario. And then together we go and decide which surgery is best for them. I try to make it so that way they are very involved in the decision-making process. So that way when we do this for them, they're all in and they're ready to go, and they're excited about it because it's really their idea. Once these surgeries are done, it's not like taking out an appendix or fixing a hernia where you do the surgery and then we never see each other again. In this scenario, we're going to see each other at least 5 or 6 times in the first year, and then we're going to keep following you for 6 or 7 years after your surgery in order to make sure that you're doing well and meeting the benchmarks and that you're having the success that you deserve. When I was in my early 20s, I moved to Argentina and I lived there for 2 years. I was a missionary for the church that I was involved in, and it was a phenomenal experience. So I'm fluent in Castilian Spanish, and I speak a lot of Spanish to my patients. And then I was able to go down there and really we just serve the people of Argentina. We help them build houses and plant gardens and clean dirty lots. And I mean, we just did anything that the people needed for 2 years, and it was really phenomenal. I really do try to live the lifestyle that I teach. I'm super active. I hike as often as I can hike. I ride mountain bikes. I jog. I run. I will do basically anything that anyone wants to do. I'm a yes guy. I'll do it. So, and I just like to live every moment of life to its fullest. Very careful about what I eat. I try to follow a high protein, high vegetable diet, just like I teach my patients to do.